Welcome back, everybody. May is Hepatitis Awareness Month. Do you know what causes Hep C, how you get it, and how you treat it? Well, nurse practitioner Alex Lapisaran of Digestive Health Associates joins us to explain. Hello, Alex.
Good morning.
Good morning. Thanks for being with us. Okay, so what is hepatitis C, and how is the virus actually transmitted? How can you get it?
So hepatitis C is a virus that attacks the liver. It causes inflammation of the liver, which could lead to cirrhosis, liver cancer, and even death. Now, hepatitis C is transmitted through blood only. So it's a blood-borne virus. It's the most common blood-borne virus in the U.S., more common than HIV.
So what are the symptoms? If someone says, I wonder, I may have had contact with someone else's blood. I wonder if I have it. What are some of the symptoms of Hep C?
So this one of the main issues with hepatitis C is that not know if they're infected or not because of the absence of symptoms. So we do not know if one person sitting next to you has hepatitis C, so the general public is unaware if they're infected or not.
Where does the fever, fatigue, nausea, all of those things, where does that come in? Is that something that happens, before that you just may look over?
Yeah, so those symptoms are classic symptoms when somebody is exposed to hepatitis C virus on onset. So people may have those symptoms in an acute exposure, but the trouble is majority of those patients who become chronically infected, so those are people who've had it for a long time, they may not have any symptoms at all and unaware if they're infected or not.
So let's say, okay, you find out that you have Hep C. What are some of the treatment options for those who have it?
Yeah, so for those with chronic hepatitis C, there's actually a good thing, if there is such a good thing. New medicines that were released late last year offers a success rate to actually cure hepatitis C. We've been able to cure hepatitis C for quite some time now, but with the release of new medications late last year, we are able to cure hepatitis C with a rate of as low as 80% to as high as 97%. And the treatment duration can be as short as 12 weeks and as long as 24 weeks.
Wow, pretty impressive. If someone would like more information about Hep C, where can they get it?
Yeah, so they can reach out to St. Mary's website, or they can call us, the Digestive Health Associates, 829-7600, or go to our website. Now, before I go, let me just point out an important point. The main thing with hepatitis C is that, as I mentioned before, majority of people are unaware. So we want to make sure that people are tested, because there's no guidelines right now to recommend testing for hepatitis C. So as I mentioned, it is transmitted through blood. So people who've had a blood transfusion before 1992, people who've done intravenous drug use, intranasal drug use, people who've had needle sticks, people in hemodialysis, people who have tattoos. And most recently, the CDC came out with a formal recommendation to test all baby boomers for hepatitis C. So the main thing is get the people identified, so that way we can offer a cure to those.
Alex, thank you so much for all that information. I appreciate it. A lot of good stuff there, and you can find also a link to this on our website as well. All right, stay with us. We'll be back with a look at your forecast.